I call the meeting, call to order the May 27th, 2020 meeting of the City Council. And for all those that haven't been participating the last month or so, we're doing everything by internet and video streaming. So we have a call-in number, and we encourage all the citizens to participate in this meeting. And we're going to have public hearings of item number 5 and 6 tonight, and then citizen comment period for number 11. And if you want to participate in either the public hearings or the citizen comment period, we ask that you call the phone number I'm about to give and write this down so that probably won't be repeating this anymore tonight, but write it down now. 844-844-9200 is the phone number. And when you dial that number, you'll be prompted to enter a meeting code or a promotional code, and that will be 398145 followed by the pound sign or the tic-tac-toe board, the hashtag, whatever you want to call it. Message come on saying question and answer session has started. Press the star button and the number 6. Then you'll be placed in queue and you'll press the number 1 when it's time to talk. So again, the number is 844-844-9200. The entry code is 398145 pound sign. When the message comes on, press star 6. Then you'll be asked to press the number 1 so you can speak. That's been presented. So tonight I would like to ask for a motion to adopt the meeting agenda. I do have one addition that I would like to add to the meeting agenda tonight. It was mistakenly left out, but we didn't put citizen comment period in. So I would like to adopt a motion or have a motion to make number 11 the citizen comment period. Need a motion, Mike?
Yes, sir, please.
Pardon?
I will make that motion.
Okay.
Okay.
All in favor, say aye.
Aye.
Now I'll ask for a motion to approve the meeting agenda as just presented. I need a motion.
I'll make that motion that we approve it.
I need a second.
Second.
All in favor, say aye.
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 Aye. Thank you very much. That's a 5-0 or 4-0 vote to approve the agenda for tonight. So next up is number 3. Item number 3 is to consider approving the consent agenda. Is there a motion to approve the consent agenda?
I'll make that motion.
Mr. Allen? Any seconded? All in favor, say aye.
Aye.
All opposed? The consent agenda was approved 4-0. Item number 4 is matters for council. Does any council member have anything they would like to share or pass on at this time?
Mr. Mayor, Mr. Vice Mayor, I've got a motion or an ordinance I'd like to present. Is this the correct time to do that?
Mike, that's going to be for the downtown.
Let's hold that.
He's saying hold it.
Okay. You seem to have a lot of reverb, Mike. I don't know why.
I think all of y'all's computers are over talking one another, Mike.
Should we be on mute?
Hold that item until we get to communication and correspondence.
Okay, I'd be glad to do that. Thank you, sir.
Thank you.
No other matters from council. We'll move on to item number 5, and that is to hold a public hearing for the sale of city-owned property at 105 Pelham Inlet. The public hearing is to hold a public hearing to receive public comment and consider adopting a resolution regarding a request by the city of Waynesboro to sell a 0.15 acre section of city-owned parcel at 0 Village Drive, Waynesboro, Virginia, tax map number 22-25-A to Hodge Richard E. Trust and Hodge Lois Jane Trust to be adjoined to the property located at 105 Pelham Inlet, Waynesboro, Virginia, city tax map number 231212 in accordance with the subdivision application 20-011. Mr. Jude, do you have a report?
I do. I don't have a particularly formal presentation, but I'll explain the issue and show you all where it's located. Share the screen. So this here is our GIS out on the western side of the city. The property is located here at Pelham Inlet off of Pelham Drive here. And the house is this one, 105. You can already kind of see where the issue lies. So the way that this is right here is a city-owned stormwater facility. And this house adjacent to it, as you can see, has a non-conforming rear setback. For whatever reason, it's an odd-shaped lot, and they built the house against the corner there back when it was built. And as you can see, the tree line and the fence line and the shed of what appears to be and what has been used as their backyard does not actually conform to their property line. Recently, the owners of the house passed away, and their children have attempted to sell it and have run into the non-conforming setback issue and the issue of the remainder of the backyard not actually belonging to them. I pulled up here on the, if I can get this down. On the Google Maps here, you can kind of get an aerial view and roughly a sense of how that backyard lies. They approached the city and asked if we would be willing to sell that section of the city-owned lot to them in order to allow the house to be sold. We spoke to engineering and the stormwater division, and they've said that there's no use for that specific slice of property that they're requesting, that it's not crucial to the functioning of the stormwater pond, which is located further south. And so we proposed that the city approve this lot line adjustment and sell them about 6,000 square feet to add to that lot. Because they already have the maximum or the minimum setback of 75 feet for the RS12 district, this does not create any new subdivision entitlements. They couldn't divide this lot again with this extra square footage. So it really would just be the value of having the backyard out to the tree line there. Our city assessor assessed the property at about $735. At least it's marginal value to their property, relatively minor. However, we do want to go ahead and charge them for that, as well as all the fees associated with the deed and with the advertisement, simply because we don't like to incentivize encroachment and then purchase. So the city staff recommends that we approve this sale and approve the lot line adjustment, giving them 6,000 square feet of property.
Does anyone have any questions for staff or the staff report?
Nope.
I hereby open the public hearing. If you want to participate in this public hearing, now's the time to call in to 844-844-9200 when prompted for an access code 398145#.
I have one in queue.
Okay. Mr. Henderson, it looks like we do have one in the, okay,
Okay.
one citizen caller.
All right. Do I talk to them am I talking to them now?
We're gonna put them through hopefully here.
I think we lost them. They're out of the queue. They're out of the queue on this question. They can enter back into the queue if they would like. The question and answer session still live. They can enter back into the queue if they have a question on this one, or if they had a different one, they can hold it.
Let's see. Mr. Henderson, for the benefit of the caller, that it looks like they've dropped out of the queue. If they could call back in, we'll hold for a second for them.
Okay. If you just called in and were dropped out of the queue for this public hearing on the piece of property that we're going to talk about here, please call back in. We'll give you a couple of minutes to call in.
They're still in the queue, but haven't re-entered the question. They pulled themselves out of the question period of the queue.
So you can't.
I can't force them into it, but they can hit the. If they want to enter again, they can hit the star 6. Yeah, if they would like to enter. They can press star 6 and then 1, and it'll add them back. Or if not, we can leave the public hearing open for a second to see if anybody else calls.
Mr. Henderson, if the caller could hit the star 6 again, if they'd like to get back in the queue and ask a question or make comment rather.
Okay. The caller that's back in the queue, if you could hit the number or the star and number 6, that'll bring you back into the meeting so you can talk.
We're still
Okay.
They might just be listening to the meeting.
The caller may just be listening to the meeting on the phone, but they're not
Okay.
entering into the queue. Again,
All
if the
right.
caller would like to make comment to the council, you'll need to hit star 6.
Okay, last chance. If you want to come into the meeting room to make a comment, hit star 6, or we're going to close the public hearing.
So I'm gonna hit next question and they should be able to speak now.
Okay, the caller can speak now.
Oh, they did.
Hello.
Hello, caller. Can you please state your name and your address? And
Yes, this is Chanda McGuffin. I only want to speak at the citizens part, so that's why I haven't been answering you, because I'm not trying to speak on this topic.
okay, all right, we'll get you back here towards the end, Shanda.
Okay.
Okay, thank you.
Mhm.
All right, no other callers. I'll close out the public hearing. Do I hear any motion to adopt a resolution authorizing the sale of the property?
I'll make that motion.
Motion made by Mr. Allen. Do I have a second?
Second, I wasn't sure if Ms. McCutcheon made a second or not there.
All right.
No.
Second made by Dr. Hossetter. Do we have any discussion on this matter? Hearing none. Let's take a vote. All in favor of approving this, say aye.
Aye.
All opposed? Hearing no opposed, I announce the outcome of the vote as 4-0 approved. This
Mr. Vice Mayor, if I can comment, please, on this matter.
Pardon me?
That's the council, I believe.
Do you have something?
This is Melissa. I just wanted to note to Mr. Hamp that the city attorney's signature is not required on this deed because it's from the city to the citizen. So I don't need to sign it, and it will be good to go with his signature and ready to record.
Oh, okay. Thank you.
Thank you. All right, item number 6, public hearing regarding fiscal year 2020 budget amendment. Item number 6 is to hold a public hearing to receive public comment and consider introducing an ordinance amending the fiscal year 2020 budget ordinance for the city of Waynesboro by adding a budget amendment number 2. Mr. McCormick, do you have a staff report?
Could you mute yours? Can you guys hear me okay?
Yes.
Yes.
So if it's all right, I'm going to share my screen so that you can see the ordinance itself, and I'll kind of walk you guys through what the intent of the ordinance is. So this is the second amendment, or the second official amendment. We've had some ordinances along the way, but only the second one that required advertisement and public hearing. So the first section of the amendment serves to appropriate and move money from the fund balance of the general fund to the CIP fund. So that's this section here, and that's the same. This is just the offset, and I'm sorry, I zoomed out further than I wanted to. This is just the offset in the CIP fund down here, and what that is moving is a 20% match for both the Greenway Phase 2B and Phase 4, the Southern Corridor Reserve money, and then the Data Refresh Center. And then it's also moving about $10,000 to replenish the major maintenance reserve in the CIP fund. And the total amount of all of those comes up to the $930,038. The second part of the amendment moves $21,894 from your assigned fund balance and your minor maintenance, or from your assigned fund balance from last year to your minor maintenance reserve. So it basically increases or replenishes the minor maintenance reserve that council adopts. And I think that's at 300,000 current, or we'll be back at 300 once this is adopted. And then the last piece is the CAPSAW funding. The first piece is an original appropriation for CAPSAW. And then the second piece is for the CARES grant. They got some CARES grant money, that they were made aware of. And the funds will ultimately be distributed to agencies selected by CAPSAW's board. The budget amendment was advertised on Wednesday, May 20th, and it does require a public hearing. After the public hearing, if you guys choose an introduction, second, and any discussion of the ordinance would be needed, and then the ordinance can then be adopted at your next business meeting.
Mhm.
All right, thank you, Cameron. Any questions for Cameron on this matter?
Well, so this is actually the current fiscal year, not the next fiscal year. So this is sort of accounting for what we're dealing with right now. Is that correct?
Yes, sir, that's correct. It's FY20. The transfers are all be made during FY20. I'm assuming you're speaking about the general fund and the CIP fund piece.
Correct.
They'll all be made for FY20 from what was left over in FY19. It's similar to how we did it last year. We backfill anything we have out of fund balance and that's needed to supplement the CIP plan from the prior year during this year to try and refrain from inflating the next year's budget early on.
Okay.
That sounds good.
Any other discussion? Okay. After hearing that, I hereby open the public hearing, and staff will facilitate the call-in. Again, the call-in number is 1-844-844-9200, access code 398145, followed by the pound sign. And when you hear the Q&A session start, press the *6.
And we do have one person in the Q&A session for this public hearing.
Okay.
You could unmute me. I'll follow on to the meeting. So they should be on now.
Hey, can you hear me?
I actually don't. Yes. Hi. I actually don't have a question. I was trying to get these comment section
What-
of the
We need her name.
meeting.
Okay, that'll be,
Oh, I'm sorry. My name,
that'll be in just a little bit. If you want to mute your phone, get you back into the queue when we have comment period, okay?
Yeah, I can clear the
Okay, yes,
queue
sir.
and they can enter back in.
Okay. No other calls waiting?
No, sir.
Okay. I hereby close this public hearing. Is there a motion to introduce the ordinance amending the 2020 operating budget?
So moved.
Ms. McCutcheon made the motion. Is there a second?
Second,
Mr. Allen seconded the motion. Is there any discussion? No discussion. All in favor say aye.
Aye.
Any opposed? This will be a 4-0 vote and it'll be brought up again on our next meeting, right?
Right.
Okay. Item number 7 is a resolution, Augusta Health Memorandum of Understanding. Item 7 is to consider adopting a resolution authorizing the city manager to enter into a memorandum of understanding with Augusta Health to facilitate Augusta Health's participation in the 340B pharmacy program. Mr. Hamp.
Yes, sir. Mr. Vice Mayor, members of council, as you know, Augusta Health is a nonprofit hospital that plays a vital role in our region in the healthcare safety net by supporting programs, especially by supporting programs that benefit indigent, uninsured, and underinsured populations in Waynesboro and the greater Augusta area. Augusta Health desires to participate in a drug discount program established under Section 340B of the Public Health Services Act. I think that program is more commonly known as the 340B program. In order to participate in the program, hospitals like Augusta Health must contract with a unit of state or local government pursuant to which participants commit to providing healthcare services to low-income individuals and individuals who are not entitled to benefits under Medicare or eligible for benefits or assistance under Medicaid. Presently, Augusta Health does that, and so the memorandum simply formally confirms that commitment that the hospital makes to the city of Waynesboro and the region. Again, Augusta Health seeks to formalize that commitment by means of a memorandum of understanding. During the term of the MOU, Augusta Health intends to continue its commitment to provide healthcare to indigent, uninsured, and underinsured residents of the area, including low-income residents who, again, do not qualify for Medicaid or Medicare. By entering into an MOU with Augusta Health, it does not preclude the city from entering into other MOUs from providers who might request to do so. And this arrangement can be canceled by either party by furnishing the requisite 60-day notice. It's a fairly straightforward recommendation. And again, this allows Augusta Health to avail itself to discount pharmaceuticals, thereby lowering the expense of cost of care to these uninsured and underinsured individuals. Happy to answer any questions you might have.
Thank you, Mr. Hamp. Are there any questions concerning?
Mr. Hamp, are we the only government entity that would be covered by an MOU, or are they in the same relationship with Stanton and Augusta County?
Now, Dr. Hostetter, I don't know the answer to that question. I don't know if they've reached out to Stanton or Augusta County. And I apologize that I didn't think to ask, but I'm dealing exclusively with that commitment to us. If that's
Sure.
important to your consideration, I think we can pause consideration and I can solicit that. And
I don't know that it is. I just wonder if this is, as you say, it doesn't look like we're being committed to any financial grouping or anything like that. So I just wasn't sure if they were just reaching out to one entity or to all three.
I don't know the answer to that question, sir.
Okay.
Any other questions? All right, hearing none, is there a motion to approve this resolution?
I'll move to adopt.
Mr. Allen moved to adopt. Is there a second?
I will second that.
Dr. Hofstadter approved the second it. All in favor say aye.
Aye.
Aye. Any opposed? Hearing none, the vote is 4-0 in favor of approving that resolution. Thank you, Mr. Hamp.
Thank you.
Item number 8 is third quarter financial report. Item number 8 is to receive a financial report for the period of March 31st, 2020.
Mr.
Could you mute your speakers, Mr. Okay. Can you guys hear me okay?
Yep.
Yes.
Okay. So this report, it's going to cover the period through March 30th, 2020, starting July 1st through March 30th. Probably should point out that this report would include numbers that are for the most part clean of or not in the beginning of the COVID-19 stages. So the graphs that you have at the beginning have some data from, I think, April in them. From March, the actual March data. The reports through March 31st, it's going to run about a month behind. So you're going to have February meals tax in that number and January sales in those numbers. So at that point in the year, revenues were tracking at approximately 80%. That's what you would expect because your personal property taxes and your real estate taxes, which are a good chunk of your revenue collections, are due in whole in December. It was mostly due to, again, we had strong meals at that point, sales, and the property tax showings at that point. The water funds were on pace. Consumption was down some. We don't believe it'll impact the overall position of the fund at the year end because we had pretty strong facility fees where vendors or commercial builders come in and pay for facility taps and things like that. Those were up. So even though consumption was down some, it more than likely would have evened itself out and probably still will. We did take that into account when we were developing the 2021 budget estimates to do for the consumption though. Expenditures for the funds were all tracking behind the 75% mark, which is good. And a lot of that has to do with timings of payments and transfers. But all the funds are on pace to come in at or below budget. The last three graphs show your meal sales and lodging tax trends. March was up slightly from prior year for sales tax. That's probably due, or we think it's probably due to the stockpiling beginning at the beginning of the COVID-19 pandemic. April sales tax will be received in June, May and July, and June and August, and we'll continue to keep you up to date as we get those. The meals tax numbers, as expected, were down in March. We probably expect them to continue to trend down during April as the restrictions got tighter, probably in May as well, and then hopefully to start to pick back up in the coming months. The lodging tax seems to be kind of tracking the meals tax more than the sales tax. These were all accounted for when we brought you estimates for what we thought the loss might be during 2020. Numbers are actually a little bit better than what the loss would have projected. We were a little bit more conservative in the loss. So we have plans in place to get through the end of the year and make sure that the fund balance, the input from fund balance from this year is adequate for next. If you guys have any specific questions on any of the lines in the report or on any of the graphs, I'd be happy to answer them now.
Any questions for Mr. McCormick? Looks like you did a good job, Mr. McCormick. Questions? Everybody can sit back in the seat. We don't have to take any action on this when we go on to number 9 now.
Thank you.
COVID number 19, report and update. Item number 9. Item number 9 is to receive a report and update from the Deputy City Manager regarding COVID-19 and reopening plan in the city of Waynesboro. This is the one I want to hear good news on, Mr. Shaw.
Mm-hmm.
Well, Mr. Mayor, or Mr. Henderson, I hope that I can provide it. What I would say, what I wouldn't do this evening is just talk about the status of reopening city facilities and city buildings and talk a little bit about some of the federal funding that has been made available to us from the, in response to the COVID-19 epidemic. But I would preface any comments by saying that, you know, I heard somebody the other day saying we're all, whether you're in the medical profession or local government or retailing, having to proceed without durable information. And I think what they were intended is that, you know, we are constantly having to respond to changes either in public policy that are being, you know, policies and guidance that's being provided by the CDC or the Virginia Department of Health or the governor's office, or we're responding to evolving knowledge about the virus itself. And so I can remember back in the early days, the CDC was saying that face masks, for instance, were primarily to be used for medical professionals, that we wanted to save N95 masks and that they weren't that helpful in trying to prevent the spread of the disease. And now we've obviously had an about face. And conversely, early on, there was a lot of concern about wiping things down and cleaning surfaces. And maybe some of you had the same experience as my wife and I, that we would bring groceries home and bring them into the basement and wipe everything down before we put them on the shelf. And now the CDC is saying that while the virus can live on a surface, that is probably a lesser concern for spread than may have originally been thought. And so all of that to say that whatever I tell you tonight may change. And we certainly, as we've gone through our response as a community and as a municipal government, had to be flexible and had to be nimble in terms of how we respond to the COVID-19. I do think, and this is perhaps a personal editorial note, that we will be dealing with COVID-19 for some time now. I think there was some thought that, you know, this would be over by summertime, and I doubt that that's the case. Now, we all hope that we start to return to some degree of normalcy in our lives, but I think we will be dealing with COVID-19 for some time. With that, let me share my screen. And as I say, primarily this evening, I would like to just give a status report and then give some thoughts, our current thinking about some of the federal funding that's available to us. I would say that as we talk about recovery, that doesn't necessarily mean back to normal. That as we look at the different phases of reopening, that it seems to us that it will be some time before this is all gone and we're back to life the way it was exactly before COVID-19. But my hope is that we are certainly transitioning. By way of update of cases in our health district, we're in the Central Shenandoah Health District, and it's pretty extraordinary that within our district, in our region here, Bath County still has no reported cases. They're one of the few localities in the Commonwealth without a reported case, whereas the Harrisonburg and Rockingham communities have been particularly hard hit. You've got well over 1,000 cases in those two communities combined, more than 100 hospitalizations, and really a significant number of deaths, 27 deaths between those two communities. Here in Waynesboro, we currently have 41 identified cases, and we've had 2 hospitalizations among those 41 cases. The Virginia Department of Health did administer a free testing clinic here on May the 5th with the help of the Virginia National Guard, and it was open to anyone who wanted to get a COVID-19 test. The person did not have to be a resident of Waynesboro, and they didn't have to exhibit any kinds of symptoms. Of the 250 tests, there were 7 positive tests. 2 of those were folks who were residents of Waynesboro. Only 1 of the 7 reported that they exhibited any of the COVID-19 symptoms. So the other 6 folks that tested positive were asymptomatic. So that's considered a little less than 3% positivity rate, about 2.8% positivity rate. which is lower than I think the statewide experience in similar type of testing. And certainly in some of the nearby jurisdictions that the positivity rates were higher. I don't think you can imply that that means, you know, that only 2.8% of folks in the population have the virus, because anybody, by virtue of the fact that somebody volunteered to come for testing, means it's not an entirely random sample. So recently, the governor extended a phase 1, which is, you know, and as you may recall, that the governor issued a stay-at-home order by Executive Order 55 on March 30th, and that runs to June 10th. The stay-at-home order was amended by Executive Order 61 on May 15th, and that is considered entering into the first phase of lifting the stay-at-home order. And so we refer to this as a safer at home order. Still, folks who are in a considered vulnerable population, someone over 60 or 65 years of age or has a specific medical condition is safer at home, that we're generally safer with social distancing, but some non-essential businesses were able to reopen with specific safety restrictions, as were faith-based communities. Church services were able to resume at about half of the occupancy of the church. And, you know, we continue to practice social distancing. Teleworking or telecommuting is still advised. Face coverings are recommended in public, and still no gathering of more than 10 people. Now, you may be aware that in the last day or so, the governor also issued Executive Order number 63, which will require face coverings indoors in public settings, retail stores, restaurants, and including municipal buildings beginning on Friday. There's still some concern about the enforcement of the order. As it looks today, the order would be enforced by the Virginia Department of Health under the direction of the state health commissioner. And that would not be enforced by local law enforcement. A complaint would have to be made through the channels of the Virginia Department of Health. And we're currently working with the Department of Health to understand exactly how that enforcement will look and how complaints would be received. We don't quite know yet. The governor hasn't indicated exactly what phase 2 will look like. So we're making some assumptions based on what phase 2 has looked like in other states, what the federal guidance for phase 2 lifting of restrictions looks like, and you know, some of the guidance that has been provided to governors by the CDC. So in phase 2, we would still assume that there is a safer at-home mentality, especially for vulnerable populations, that there would be an easing of restrictions for businesses, but that social distancing, while relaxed, would not be eliminated. There would still be recommendation to continue teleworking where appropriate, but that the number of folks that could gather might be increased to 50. Again, these are some assumptions that we're making, and they don't come from the governor's office, but we're trying to anticipate what a phase 2 might look like. We do assume for the city and for really other types of enterprises that there would be some sort of a phased reopening, that we wouldn't simply reopen all of our facilities and return to programming and so forth as we had previously conducted, but there would be a phased reopening. Still, the swimming pool is closed this summer. The extravaganza would be canceled. A lot of the parks and recreation programming would not resume, simply because phase 2 reopening might commence in a matter of weeks. We're making decisions about our preparedness to reopen based on a number of factors. First, we're looking to guidance from the governor's office. So we take our cues from the governor. And the governor, as we understand it, and his his administration are monitoring the number of cases, the rate of new cases and hospitalizations, judging hospital capacity to be able to take on new cases if there is some sort of a surge. Also, the testing capacity in the Commonwealth is one of the metrics that the governor's office uses. And then as well, they monitor the supply of personal protective equipment. Then as it comes to us, we look at our own preparedness in terms of health and safety protocols that are either in place or would have to be in place as we reopen and have more people returning to the workplace. Amongst those things are concerns for basic hygiene, that is having hand washing and hand sanitizers available, and things that we might do in the workplace to encourage better hygiene, for instance, the installation of touchless faucets and restrooms and that sort of thing. The ability to disinfect areas as needed. In some areas, we would be increasing daily cleaning and periodic disinfection of frequently touched surfaces. Got continued social distancing. We're going through a process of evaluating workspaces and work processes to ensure that appropriate social distancing can continue. We're evaluating travel policies that we currently obviously have a ban on city-related travel. There are increasing numbers of questions for employers as to travel policies for the employee on their own time. And obviously we're in vacation period, and there are a lot of discussions about what happens when employees come back to work from having traveled. And then as well, that we want to ensure that there are training, documented training requirements in place for all employees as they return to work. Now, bear in mind that we have had a number of employees in public safety, police officers, firemen, the Emergency Operations Center, as well as essential employees in public works who have continued to work through the virus. And they have had special protocols in place in all of their various duties that will continue really without amendment. And then finally, all of us will continue to monitor either through on-site health checks that we currently do temperature checks in a number of our facilities and as people come into the workplace. We continue to monitor things like leave policy. There are federal guidelines that have been passed down that are very specific to the COVID-19 pandemic that take sort of a constant measure. We look at local cases every day, and we continue to monitor whatever the latest guidance coming from the Virginia Department of Health or the governor's office. I think that we had targeted initially, and I think we're still looking at June 10th as a date when we might start to reopen some facilities in a phased manner, simply because that was the date that the governor established for reopening or an end of the stay-at-home order. So that could certainly be modified or amended, and that would affect our business plan. But I think one of the things we'll want to communicate to the public is that they should expect that business processes might be modified, that as they come into city facilities, they might find folks, for instance, working behind sneeze guards, or that some offices would be available by appointment and things like that. Not that it would take time necessarily to get an appointment, but we might prefer to have that appointment either conducted by telephone, by a Zoom meeting, or in a conference room big enough to provide for adequate social distancing. I think in the early phases, you would still see that many of the city facilities are not available to the public, that rooms, for instance, wouldn't be available to outside meetings and that sort of thing. So I think if, and as well in the current setup in public safety, I think the protocols for a police officer responding to a scene or firemen responding to emergency medical calls and fire scenes are going to continue to be based on the protocols that we've put in place. One of the concerns that we have and that we discuss a lot are that we expect that employees, the city council, and the community at large will have varying opinions on what is considered to be safe and appropriate. I know that the wearing of face coverings and masks has become something of a controversy, and we can assume that there will be people who will be upset if they see people not wearing a mask, or that employees feel like everyone should be wearing masks all the time, and we will have people who are upset because they have to wear a mask in different settings. And I think we just have to be able to develop guidelines, again, that are based on best practices as communicated by the governor's office, the Virginia Department of Health, and the CDC especially, and then stick to those practices and protocols. I think we recognize that reopening will increase the risk of spread, that as long as there are more people in more frequent contact with one another, then there is an increased risk of spread. And so we have to remind our employees to be diligent, and we would encourage the public to be diligent. But I know that, for instance, the folks who have been working through now, their protocols need to stay the same. That, in fact, we want to sort of redouble the effort. At the same time, I think there's a growing recognition that fatigue, or quarantine fatigue, is a real thing, that there are people who are weary of quarantine and people who are weary of all of the special measures in place. And as a community, but perhaps more as a society, we have to figure out ways that we're reducing the risk of transmission in a sustainable way, that we're taking on habits that we can sustain over time, and that but still provide some measure of safety. One of the things that we're doing now is going through assessments of the workplace and various programs and activities to understand the contact intensity associated, that is the how close do people have to come to with each other to be able to complete a task or to provide service, the number of contacts that somebody might encounter in a particular activity or in the course of a day, and the degree to which activities can be modified. That OSHA actually provides guidelines to protect employees during pandemic, and they have what is considered a hierarchy of controls. And at the top is social distancing or physical distance, that nothing beats physical distance. And then the last line of defense, so to speak, are PPEs. That's face mask, and especially the types of PPE that you see in a medical setting, where there's an N95 mask and gowns and those kinds of things, where there's just, you have to find yourself in contact with somebody who may or in fact does have COVID-19. We have a range of employees who, according to the OSHA guidelines, are considered anything from a very high risk, that those are paramedics and EMTs that work in the fire department, or the folks we work with at WAFAC, to folks who are considered very low risk. And those are folks who, primarily office workers, who see a relatively few number of people in the course of the day and can maintain distance throughout the course of their workday. In between are a number of engineering or administrative controls that can be put in place. So again, kind of going through the measures or controls that are available to us as we reopen and as we bring people back into the workplace. Still, teleworking is a recommended option, and we are going to have employees that continue to telework. We have a number of employees who work for us that spend the bulk of their day in an office in front of a computer screen, and they have jobs where it makes sense that they don't have a great demand to be in contact with the public, or to even frequently meet with supervisors and coworkers, and a lot of them will continue to do a lot of teleworking. And in fact, a lot of their jobs, you can even measure their productivity through a computer more than through some sort of physical task. Still maintaining 6 feet of separation. We'll have rules and guidelines in place in the workforce, no handshaking or hugging or those kinds of things. I'm sure that, we'll have restrictions on the use of common areas, that some of the engineering controls. We do temperature screening now in the police department, fire department, and we look at ways of controlling traffic within buildings to try to make sure that people can stay separated. We're looking at various types of barriers like sneeze guards you see in a lot of retail establishments now, where we have customer facing employees, and ventilation. That air movement is a big deal, so being able to air out rooms where people have met or to do things outdoors may be more safe than doing something in a very small and confined space. The types of administrative controls that we can imagine we'll have in place would be restrictions on visitors to public buildings, and restrictions on the use of common areas. And so a lot of our meetings we will continue to do remotely, or we'll encourage people to do business with the city, either by telephone, by email, by Zoom meeting, by online services, or whatever they may be. Obviously, communication and training is of paramount concern as we talk to employees and work with employees and the public at large, stepping up disinfection in certain areas, and then reviewing constantly leave policies. We've adjusted a lot of schedules to try to prevent overlap of employees, that separating work crews, creating different schedules for different work crews so that they don't come in contact with one another. We have at this point had a number of employee quarantines. We've had about 6 quarantines, and fortunately, none of them showed that someone had actually either been infected or been affected by the COVID-19 virus, but we have had a number of quarantines, and in most cases, things worked out because we had been keeping work groups separated, or that we had folks already working at home, and that the quarantine didn't disrupt our operations. And then finally, the use of PPE, gloves and masks and that sort of thing, that obviously, as the governor directs, the use of masks, then we follow suit in the way we conduct our business. As we understand it, gloves are still important in a task, especially related to cleaning and disinfecting areas. As we think about different strategies, we look to gauge, one is the effectiveness of the strategy itself, based on what the medical profession is telling us now, the ease for us to implement that particular strategy, and then the cost for implementing a strategy. So in other words, social distancing, keeping 6 feet away from folks is highly effective, at least 6 feet away is highly effective. In most cases, easy enough to implement and doesn't cost a lot of money. Once you start getting into, screening, for instance, temperature screening, there's a greater question about its effectiveness, that by the time somebody has a temperature, they may have been shedding the virus for several days and have already passed that virus along. Nonetheless, if it's easy enough to implement, and with the police department, we do it at shift change, and you can keep people separated during that screening, then we feel like we're catching, or preventing some of the spread. It's not without some cost. There's a loss of productivity as folks screen in, and the thermometers themselves cost something, but it's not terribly expensive. Conversely, if we were trying to clock in, say, 30 or 35 people that show up to work at the Yancey building, that could take a much longer time, and you end up with a log jam where that screening line in itself can create a hazard. So the point being that we look at all of the various strategies that are being recommended and try to figure out which ones make sense for which particular work groups and settings here at Waynesboro. Shifting gears a little bit, I wanted to conclude, what I would say is that we are targeting June 10th as a date to begin some phased reopening, and for instance, at the library, that might mean that we return to curbside service, but the library building itself would still remain closed. We may start to open up some of the municipal facilities. Courts are back in session. I think some of the court facilities, the clerk's office, for instance, is available by appointment. And so I think you could start to expect that by June 10th, there would be some phased reopening of facilities. It doesn't mean everything is wide open or programming resumes as usual, or that all of offices and all employees are back at are open and employees back on the site. But we would expect to start to increase our levels of on-site service. Turning our attention a little bit to some of the federal grant money that we've received, I'm going to focus on two significant ones. One is as an entitlement community, we participate in the Community Development Block Grant Entitlement Program, which means we get a regular allocation of block grant money directly from HUD, and that amount is usually in the neighborhood of $180,000 to $200,000 a year. And as an entitlement community, we're receiving an additional $114,000 of funding. There are a couple of ways to receive the money. You can either amend the current annual plan that we're working in. We work on a federal calendar for these funds. So we're currently in federal fiscal year 2019. We can either amend that plan or we can incorporate these funds into our 2020 plan. Since we normally do that during the summer months, July and August anyway, we felt like it probably makes more sense to incorporate the money into our 2020 plan for a couple of reasons. But to bear in mind, with these funds, we still have to meet national objectives of benefiting low to moderate income persons. And I think we've seen a map periodically of where those low to moderate income neighborhoods are in the city. We have to, we can use the money to aid in prevention and elimination of slums and blight. And then as well, you can respond to a disaster and this money is primarily meant to be for disaster relief. So the types of sample uses, we may partner with an outside agency to provide, for instance, individual rent or mortgage or utility assistance. That the CDBG program allows that you could provide an individual household with such assistance for a period of up to 3 months. We would look to, again, to a partner to help do that because we really aren't set up for such an application process to demonstrate need. Another option that we feel like is viable because we feel like we could speed relief, so to speak, would be to contribute to another human service provider in the community. And we're exploring some of those options at present. And then finally, the money can be used to supplement your current program. So there are things that we would normally do that are infrastructure projects and economic development, business relief, things like that, that would be part of, you would normally see, you're used to seeing in your annual CDBG plans, that we simply could use the money to supplement those programs. What you can expect is that, unless directed otherwise, by July and August, we would return to the council with an annual plan that incorporates these funds. And I'm sure that we'll have conversation and planning ahead of that, but that would be the time frame that you could expect to see hard and fast recommendation. The other sum of money is obviously new and unique to the coronavirus pandemic and the federal relief, and that is the CARES relief funds. As you found out at your last meeting, the city is the recipient of just under $2 million, more than $1.9 million in federal relief funds. And that is meant to reimburse costs that are necessary expenditures incurred due to the public health emergency with respect to the virus, and that these funds couldn't have been accounted for in the current budget as of March 27th. That was the day that the the bill was passed or signed into law rather, and then we can apply reimbursement against any costs that were incurred during a period beginning in March of 2020 and ending with on December 30th of 2020. This program is also makes explicit that the money cannot be used simply to fill a revenue shortfall of the local government, which comes as a point of some consternation. That what we're finding is that there are certainly costs associated with responding to COVID-19, but where our most critical need is as a local government in terms of providing general services is has to do with revenue shortfall. But, and I think there's a very active effort on the part of local governments in Virginia and across the nation to either revisit that issue or to try to understand what are the full range of uses available for this funding. As opposed to CDBG funding, where you have a standing program and they're simply increasing the funding to a standing program, so we know the guidelines. This is a new program, and so the guidelines, while are generally provided to us, they're not as explicit as one might hope, and they have not been tested. So that no one's been has tested, the full breadth of eligible activities. But some of the expenditures that we have identified and that we feel like we either are currently spending money on things that we would seek reimbursement or can anticipate. One would be the provision of PPE for our employees and potentially for the public as we look through not only in public safety positions, but also in other work groups where we will be required to have face coverings, then we will be providing those. We also think that it makes sense to provide at least face coverings for folks who enter our buildings that may show up without a mask. Preparation for teleworking is an eligible expenditure, and certainly we've spent money either in preparing laptops, purchasing laptops, or preparing for the network connection for the number of folks that we have currently teleworking. We can use any salary costs that are specifically related to COVID-19 response, and then any of the engineering or administrative controls that we talked about earlier. So for instance, purchasing and installing sneeze guards, or paying contract services to improve and increase disinfection during the workday. I pause there that we expect that the employee themselves will have a fair duty in making sure that their workspaces are kept clean, but there are public spaces where we would assume that we'll increase our janitorial services for sanitation and disinfection. Additional expenditures that may come to us in relation to our agreements, detention centers, of the Middle River Regional Jail, the Shindo Valley Juvenile Detention Center, are incurring cost for in response to COVID-19 as well. And some of those costs may be passed along to us that as a member jurisdiction. We don't know yet because those folks are also receiving federal dollars for some of their cost. Then any of the costs that are associated with enforcement of public health orders, and then as well, there's an opportunity to provide some business recovery through the use of grants and loans, and we're actively exploring that option. I think that will probably be an activity we bring to you, propose to you sooner rather than later. But as I said earlier, that there's still a lot of question about really the full breadth of activities that can be charged against these funds. And a lot of local governments that we're talking to are in the same boat, where they're basically seeking some guidance from the state, or we're looking to each other and saying, how are you going to use your dollars? Because we simply don't see that the types of things I've just walked through come to almost $2 million for the city of Waynesboro, and yet we just passed a budget that's one of the most financially strapped that any of us has experienced, and some of us were passing budgets during the Great Recession, and so we're hoping for some relief and guidance. Part of our suggestion as staff to the council would be not to rush into spending these dollars too quickly, because if there is a way to take greater advantage in terms of making up revenue shortfalls, furloughing employees, things like that, that we want to make sure that we've retained the ability to do that. And we do have some time. That concludes my briefing. I'm glad to answer questions as the council might have.
Anyone have a question for Mr. Shaw?
Yes, Jim, this is Jeannie McCutcheon. I would like to question about the contribution of your service providers. Does that in there, would that include social service with, I'm talking about from the burial fund side? Deaths are increasing and things are happening, you know, and I looked at your figures as far as in this particular area for the virus.
Right.
But we don't know what's going to happen, and we're being hit with people who say, I just don't have the funds now. This, you know, happened. And so I was just wondering if anything is included in what you just completed.
Right.
Any of that funds being considered in that particular area at all.
Ms. McCutcheon, I hadn't thought of that. And I don't know that I've seen that as an eligible expenditure in the CDBG funds, but it might be an eligible expenditure in the CARE funds.
Well, that's what
things is that some things are eligible in one program and not another. And so we're working through a little of that, but I'm glad to follow up on that. And because the Department of Social Services is certainly one of the agencies that we would consider partnering with. And in fact, you know, there probably are some programs that of theirs, ongoing programs that we may be able to supplement, but I'll have to follow up on that question for you.
Yes, maybe I was looking at it from the CARE, you know, relief funding kind of thing. That's what I was thinking. Thank you very much.
Yes, ma'am.
I didn't have a question in particular, but a statement. Thank you very much for putting all that together, Ms. Shaw.
Yes.
I think good job.
Very good, Mr. Shaw.
From the medical standpoint, you know, the two pieces that I would try to draw for Waynesboro residents and citizens is the fact that, you know, we have locked down severely for 2 months now almost. And the curve has flattened, you know, that in Virginia, our rates of infection, our rates of hospitalization, and the death rates have been blessedly low. But I think that's because of actions that have been taken.
Right.
As we start to think about the reopening, and I think it is your thoughts about a guided and a stepwise fashion are very well taken. I would juxtapose that against that 250 random tests that we did, and 7 of them were positive, but only 1 had symptoms. So as people think about face masks, people think about, you know, the restrictions that we're going to probably see in place for a while. Think of your mother, your grandmother, someone 65 or older. And I would say, you know, take care of them like their life depends on it. So
Right.
wearing face masks in public is a service to the rest of the community, because we know that it can be spread by people that don't have any idea that they're sick. And, you know, and it is a big change, and it is, you know, an infringement on what we're used to. But at the same time, I think it's the best information we have. I liked your phrase of durable information. We joke in the medical setting that every week, the things that we thought the last week don't make sense anymore. And we have no guess as to what we're going to understand about the virus the next week. And I think that is slowing down somewhat. In the first month, that was very true. And we are getting a better understanding, but I think it's still a serious issue that we need to move slowly on and help each other out. So thank you for your comments, Mr. Shaw.
Thank you.
Anyone else? Thank you, Mr. Shaw, for the information tonight.
Yes, sir.
Well
All right.
done.
Now, we're going to move on to number 10, which is communication and correspondence. Mr. Hamp?
Yes, sir. Thank you. I do have one fairly important item to bring to council's attention and perhaps seek action upon. In the last 10 days or so, the city has received 2 specific requests from downtown restaurateurs for permission to use public space for the service of food and beverages. I think this will be common, is common, and will be increasingly common among localities, especially in downtown areas where the proprietors do not have their own space on which to conduct outdoor seating. Personally, my sense is that the council communicates, if not specifically, generally, an inclination to be helpful and accommodating in these requests as our businesses attempt to reopen and reestablish a productive existence. And I share that inclination as well, and would want to orient my own work and that of the staff to a favorable outcome whenever possible, provided that requesters understand that we will want to preserve the provisions of the ADA and our existing ordinances to the extent possible and reasonable, and that with less flexibility require that proprietors follow the guidance issued by the governor through his various executive orders and the phasing forward Virginia program, CDC guidance, and naturally BDH health and food sanitation and ABC alcohol beverage control requirements. So none of those considerations are compromised. The 2 specific requests in front of us currently are one from the Heritage to use the sidewalk immediately adjacent to their current location whenever they're open. So they'd like to set up tables on the sidewalk that would effectively close that sidewalk. And he would intend to do that if approved during all hours of operation. More significantly, the proprietor requests that we close that portion of Lumos Plaza immediately adjacent to the restaurant on Friday and Saturday evenings beginning at 5:30 until close, which is advertised at 11. And I think I've asked staff or a number of relevant staff to take a look at this situation. Those staff members include the deputy fire chief, the deputy fire marshal, the building official, the zoning officer, and the police chief. The request is reasonable and can safely be granted, again, provided that that business operator conforms to VDH and ABC requirements complies with the governor's health and safety orders related to COVID-19. The second specific request comes to us from Mr. Jameson's. They are asking to establish tables on the sidewalk. I think that one is a little more, I'm not convinced that there's adequate space to allow passage and provide for social distancing. And I'm thinking about alternatives to that request and might engage that owner in a longer conversation about his vision for the sidewalk and what might be achievable in another location. In addition to having our internal staff, relevant internal staff, vet these requests, I've asked for Ms. Michelson's guidance, and she shared that, again, in her work, this is not unusual among localities, that you're seeing localities receive these requests and attempt to work with their restaurants to their benefit. I would pause and say, too, we want to take care that we don't, in working to the benefit of the restaurants, impart any undue or unfair disadvantage to their neighbors downtown. We're trying to strike an effective balance between recognizing that restaurants have borne what might be described as an unfair burden in this case, but we don't want to create unnecessarily additional burdens for their neighbors and other businesses. So that will be an important consideration. In any case, recognizing that we don't have all the details worked out this evening in all requests, and we won't be together as a group again until June 8th, Ms. Michelson furnishes that the council could, if you're so inclined, consider an oral resolution allowing the specifics known to date and authorizing the city manager to take any and all action to execute documents deemed reasonably necessary to effectuate the purposes of these accommodations, affording some additional authority and time and flexibility to work through these requests before we're together again in a formal meeting section. So
I think
that's
good.
excuse me, go ahead. If there was a question. That's the information I have for you. Would be my request that if you're inclined to be helpful in this regard, consider adopting that resolution and have some confidence and trust that your staff will work through this in a manner that's helpful and fair to all concerned to the best of our ability.
Thank you, Mr. Hamp. Do we have a motion to adopt the resolution?
I'd move to adopt.
Well, I've got a resolution written out here. Do we need to read that formally?
I think the
Yes.
resolution does contain some important details so that council and the listening public understands exactly what we're committing to. That might be helpful.
Okay. I would move the following, that the Heritage Restaurant may use the sidewalk, or number one, that the Heritage Restaurant may use the sidewalk immediately adjacent to its location for tables and chairs during all hours of operation, and closure of the portion of Lumos Plaza immediately adjacent to the Heritage location on Friday and Saturday evenings from 5:30 p.m. until 11 p.m. Number two, that Mr. Jameson's restaurant may set tables on the sidewalk adjacent to their location, or if space is insufficient at that location, alternatives could be considered. Number three, the above two approvals are subject to and conditioned upon the following. The establishment must comply with Governor Northam's orders regarding masks, social distancing, sanitation stations, etc., and obtain all applicable requisite permits, including without limitation from the city, the Virginia Department of Health, and the Virginia ABC. And number two, they must ensure that their insurance covers that offsite location. And number three, they must sign a simple agreement that includes indemnification and hold harmless provision. And whoops, I lost a word there. Does somebody have a copy that's got another word? I've got an N, but nothing else.
I'll take it from there, sir. And four, the city manager is authorized to take any and all action and execute all documents deemed reasonably necessary to effectuate the purpose of these accommodations.
That's what I was meaning to say.
All right, so Sam presented a motion for us. Do we have a second on that motion?
I'll second that.
Any discussion on the motion? All in favor, say aye. Aye.
Aye.
All opposed? Hearing no opposed, it carries 4-0. And that brings us to item number 11, which is our citizen comment period. And I know we've got some citizens waiting to dial in, so I'll give the phone number one more time. The phone number is 844-844-9200. The access code is 398145, followed by the pound sign. When the question and answer starts, you'll hit *6 and then press the number 1 to be put into queue. Members of council, I received one email today from a Mike Geiger. While people are waiting to queue up, I can go ahead and present this if it's okay. This was an email sent in by David Geiger, I'm sorry. My name is David Geiger, 701 Locust Avenue, Waynesboro, Virginia. I am also the chairman of the Waynesboro Historic Commission. I am writing this letter in that capacity. Last year, the Florence Avenue Bridge was under construction. The Historical Commission was approached by citizens about the naming of the new bridge. Sorry about that. It was felt that the naming of the bridge after a well-known citizen in Waynesboro was appropriate. Due to the circumstances beyond our control, this request was delayed until the time when construction is nearing the completion. Therefore, the Waynesboro Historical Commission, along with other citizens of Waynesboro, is recommending that Mrs. Augustine Bellamy be recognized for her community service by renaming the Florence Avenue Bridge in her honor. Ms. Bellamy was a well-known leader in the African-American community within Waynesboro. Her efforts promoting Black history are documented, and the 2012 General Assembly declared a day of honor for her work as an educator and teacher. Gathering together historical records on her own, Miss Bellamy created the current African-American Museum that is housed in Rosenwald Community Center. She is a lifelong resident of Florence Avenue / Port Republic Road area. I hope that the City Council will approve this honor and act upon it in the near future. Thank you, David Geiger, Chairman, Waynesboro Historical Commission. Do we have anybody waiting?
Yes, we do. Mr. Henderson, we've got two folks who have patiently waited through the meeting, and we will queue them up, and hopefully the technology will work.
Okay.
We'll follow the same protocol as we always do with public comment period, and that I'll have a 4-minute timer on speakers, and we'll ask them to wrap up at the 4-minute mark.
Okay. And just so the public knows that during this comment period, you will not be getting a reply back from council. This is strictly a comment, so you can talk to, explain to your councilman what you want them to hear, and we can get back with you at a later time.
Okay, I think the first speaker can go now.
First speaker, if you would say your name and address, and then you can start.
I'm Chanda McGuffin. I'm the co-founder of Rise and Waynesboro Lifelong Citizen. I reside at 644 Edwardian Lane here in Waynesboro. We took this up as an initiative back last year, just to give you some history of renaming the bridge. We met with Mr. Luke Juday, Mr. Shaw, and some other citizens, as well as a strategy team that we put together for the Florence Bridge, the Florence and Port Republic Road area. And at the meeting, Mr. Juday mentioned to us that it was a general consensus from the city that the bridge not be named after Martin Luther King Jr., that it be named after a local person that had contributed to our community. And unanimously, we chose Mrs. Bellamy's name. I want to share with you that Miss Bellamy personally was one of my teachers, one of my educators. Through the program that she created herself, I was honored to be able to see her impact. I was one of the students that was in an all-white school here in Waynesboro. We had all-white students, all-white administrators, all-white teachers. The only other student that was Black was my twin brother. And so we went to school through Shenandoah Heights and then through the whole school system. So she gave us a sense of pride when she came in and she volunteered. And she gave invaluable Black history at no charge to our Waynesboro public school system. I saw her create the museum from out of her home, the Rosenwald Community Center. I sat with her all day. She entertained groups coming to view her material. I saw her labor of love continue to grow and her to be honored before her passing of her life's work. With great pride, I sat on the front row as Delegate Dickie Bell read the proclamation that he had prepared for the General Assembly to declare her day of honor for her great work. In a time of uncertainty, we should look for ways to unite our community. We should look for opportunities to engage the Black community who often feels overlooked and unheard. Mrs. Bellamy deserves this recognition. She's a product of the Florence and Port Republic Road area. She was born and raised in that area, and she gave back to her community all of her life. She left our community the African American Heritage Museum, and we should thank her by honoring her with placing an engraved plaque on the finished Florence Avenue Bridge. We do not necessarily want the standing memorial. We want it actually on the bridge, similar to the place marks that's on the bridges on Main Street and Broad Street that was newly put up, is that we can have that engraved into the bridge, Miss Augustine Bellamy. Thank you.
Thank you, Ms. McCuffin. Do we have a next caller?
I believe we do. Yes, sir.
All right. Is the next caller on?
Hello. Yes.
If you
Yes.
would state
Hi,
your
my
name.
name.
State your name and your address.
Okay. All right. Hi, my name is Anitria Bellamy. I'm a citizen of Waynesboro, Virginia. I'm here to speak on behalf of my family, who would greatly appreciate the honor of my grandmother's name being put on the Florence Avenue Bridge. I'm going to give you a little bit of back history about my grandmother. She formed this Black History Museum on her own time with her own money. She never asked anyone for a dime. She gathered all the information for this museum on her own. She was so dedicated that I had seen my grandmother load her station wagon up and travel to every school in the city of Waynesboro, every school in the city of Stanton, every school in the city of Harrisonburg, and every school in the city of Charlottesville, just to teach Black history. She went as far as going into the prison systems as well. She has been to numerous prisons to give Black history presentations, and they allowed her to do so. She was trying to show young Black men that you are a product of greatness, that just because others have decided to leave you and give up on you, I refuse to give up on you. She stood by principles. She stood by what she believed in, and she wanted to make sure that every child understood that they come from not just slavery, but they come from kings and queens in Africa, that they come from people who sacrificed and struggled to get to where they are. And Waynesboro can do a lot by honoring her and showing our community that they are inclusive and that they are diverse. And by doing this, you show that you appreciate those who are literally heroes to little girls and little boys who had no knowledge of their history or no knowledge that they have great-grandfathers and great-grandmothers who did great things. But her collecting that history of certain people's families that live in this area, showing them where they come from, showing them their past, so they will understand what they need to do for their future. She worked every day just to improve the life of not only her grandchildren or her children, but other children in this community. And that's what it's all about. providing for our future, so our future know that they do have the same opportunities as everyone else. She also made it very important to the children around this area, including myself, that education was very important. That you needed an education in order to strive and succeed in this life. And my family would definitely be honored, and we will be grateful if you would please just accept the idea of honoring her and all her hard work by naming the Florence Avenue Bridge after her. Thank you.
Thank you, Ms. Bellamy. Any more people on the phone?
One more in the waiting room that's not.
What do you say?
Yes, sir, I believe we do.
Okay.
Mr. Henderson,
Yes, sir.
there's a person in the waiting room. If they would hit *6 to get into the queue, that would be helpful.
Okay, if you're waiting in the waiting room, hit *6 and you'll be able to come into the room.
Good. Okay, if
Hello,
the
can you hear me?
person on the phone could go ahead and speak.
Okay, thank you. My name is Herman Wells. I live on Magnolia Avenue. I wanted to thank the previous two speakers for their comments, and I totally support that. But the reason that I'm calling is actually with regard to the point that Mr. Shaw made earlier with regard to the governor's request or edict to have everyone wear masks in particular areas. The reason I'm actually calling and asking the board or just talking to the board about it is because my only issue is with people having to wear a mask to go into areas where food is purchased. I think a lot of us hear what the governor said, and we are all in for it. It makes sense. It follows the science. And for us, it's very easy to go purchase a mask, or maybe we have one already. But there are a lot of people within our community who may not have access to a mask. In fact, I would tell you that with the library closure, there are a lot of people in our community who may not currently even be informed that they're required to wear a mask to go into Walmart to purchase food, because they are not in social media. They're not maybe paying attention. Perhaps they have, but they may find out on Friday that they have to have a mask to go and purchase food. And that is my main problem. And I'm not sure that anyone can do anything. I'm just letting my community leaders know that no one should not be allowed to go and purchase food. Food is an important commodity. I think we believe, a lot of us say, well, it's only $4 or $5 to get a mask. It's not that big of a deal. A lot of people don't have that kind of money. Some people can't even find masks. I was fortunate enough. I had my daughter-in-law in Japan made us mask and sent us here. They're great. But I would not have a mask if she hadn't made me one. And I make plenty of money. I'm part of the community here. I have no reason that I shouldn't be able to purchase one. But some people can't find them, mostly due to the shortage of PPE. But the other thing that I'm worried about is that it could lead to sharing of masks. So let's say you live down by the river and only one person has a mask, so you share your mask to get in so that you can purchase items in the Walmart. I'm just using Walmart as an example. The other piece is what happens to our local law enforcement. So we have a person at the door who says, you can't come in because you don't have a mask. So what if the person says, I want food and I want to come in? I'm not saying it's going to happen. I'm just saying, what do? They call our law enforcement, and then our law enforcement does what? I'm not trying to make a bigger deal out of this than it is. I'm just trying to raise some awareness that we do have people in our community who may not be aware of this and may have issues starting this Friday getting food. I thank you for your time.
Anyone else on, Jim?
No, sir, that's it. We may have one written comment.
I've got one written comment here from Stacy Jones that I got from Julia just a few minutes ago. This is Stacy Jones, 335 Florence Avenue, Waynesboro, Virginia. I know there's been much discussion back and forth over the past year about naming the Florence Avenue Bridge. I've lived on Florence Avenue my entire life. My parents' original home is here and remains our family home. I cross that bridge daily. So I want to thank the council for finally getting the bridge work on so that we can get back and forth to our homes and our route. That as a resident, I fully support Miss Augustine Bellamy's name being placed on the Florence Avenue Bridge. I grew up with her children and her grandchildren. I'm close to the Bellamy family, and I know that she gave her life to teach all of us Black history. It would be an honor to see her name on the Florence Avenue Bridge. Thank you, Stacy Jones. That was the last correspondence I've received today. All right.
We have no further comments, sir.
Okay, with that, that was the last item on our agenda. Do I have a motion to adjourn this meeting?
So move.
Thank you, Ms. McCutcheon. Do I have a second?
Second.
Thank you, Dr. Hossetter. All in favor? say
Goodbye.
aye.
Aye.
Opposed? That's a 4-0 to adjourn. Thank you all very much.
Okay.
Thank you. Good night.
Good night.